eye movement, he asked the patient to get up and asked him to narrate about the dream. So that is the period when the dream part. So there, in a sleep, there are 4 stages we are going to know. The 3, stage 1, stage 2, stage 3 and stage 4 and REM. REM should be actually the dream part. Some people say it's a 5th stage. Okay. So what is of stage 1? The phase 1 is one begins soon at the sunset and when the pineal gland starts releasing melatonin. Okay, but it is not after the sunset. Nowadays, whenever you go to the bed, the first stage or the first phase or a stage is just for 7 to 8 minutes. During that time, even if slowly when there is some noise about the door, person will get it. So it is not a deep sleep. Then it goes to the second stage and then third and the fourth. Now second phase occurs in a moment. This is for 10 to 15 minutes and the third one is 5 to 15 minutes and the phase 4 is 15 to 30 minutes. But there is a REM, rapid eye movement. Now you'll ask me why the children, infants, they sleep for a longer time, maybe 20 hours, 18 hours. Because their cycle is getting adjusted. They start with a different way. They dream first, REM, and then the other stages. In you and me, what happens is stage 1, stage 2, stage 3, stage 4, REM, deep period, and entire, if you calculate the minutes and other things, roughly it is 90 minutes. So in a 90 minutes, everybody gets a dream of 5 minutes. But 90 minutes is not only the total sleep. Again the stages will repeat, but not the stage 1, stage 2, stage 3, stage 4, REM. And then the cycle goes on repeating. The most important part is, if proper REM, it has nothing to only do with the dreaming part, but many important chemicals are secreted by the brain during that phase. So the best phase for a brain to rest is stage 3. But after stage 4, that 5-10 minutes, the maximum brain secretions of neurotransmitters occurs. Neurotransmitters occurs with the maximum rate. Okay. So these neurotransmitters are important. That is why. And one of the report is given about, suppose if I don't want to get, I would like to sleep late because of some kind of studies, students and others. What do they do? Generally they drink a lot of caffeine or coffee. That make you energetic. But after getting energy, what about the brain job of making neurotransmitters or the chemicals? And because of that, someday or the other, their problems will come. The problems will be obesity, diabetes, fatigue, depression. So many diseases are related with that. And these related diseases, now as science has proving beyond doubt that there is a hormone which tells us, stop, don't eat now. The hormone name is leptin. The leptin secretion is reduced because of improper sleep. And then the chances of getting diabetes for a person who is sleeping for 7 hours as compared with the 5 hours. The 5 hours sleep, the chances of diabetes are double compared to sleep. Now these are the actual waves, how the waves start. The first is alpha waves and then there are delta waves. But the last is important is the second one, is about the REM sleep. This is stage 4, delta waves, and then the REM sleep comes. This is rapid eye movement sleep, and which is very important for the dream. The whole of the psychoanalysis mostly is depending upon the dream analysis. The analysis of the dream for a psychiatrist is very, very important. So we may have to do something with these kind of mechanisms. Now this particular slide explains practically everything. 1 to 15, 3 to 5, 6 to 23. What is the non-REM sleep? That is without dream. And with dream is REM sleep. So naturally, at the age of 1 to age of 4, the dreaming part is more. Age of 2, 1 to 2, the dreaming will be more. And that's why you might have seen the child of 1 year or infants, they laugh during this. That is because of they are dreaming. So this is the pattern. And as one gets older, around 50, 70, the non-REM sleep is less, but REM sleep is still less. And probably this REM sleep has to do something with the kind of neurotransmitters or the brain secretions which are reduced. And then the person may forget. But this kind of research, more papers may come. Alzheimer's disease and other things because of REM illness. And here if you just say the amount of hours of sleep is just 6 for a 50 to 70. Now you will say there are some old people, they sleep just for 5 hours and they are happy about it. But science says it is not that a requirement of sleep for older people it gets reduced. But they can't sleep because of so many other mechanisms, maybe the metabolism where the melatonin secretion is reduced. So in that case, there is a melatonin available for giving to the patient also. But the first thing is, there are other things. The 4 slides, last my 4 slides are very important in understanding how we can improve upon our sleep pattern. Now the first disorder, the very large thing is insomnia, means not getting enough proper sleep. Such concern may reflect poor sleep pattern, poor quality of sleep, daytime, and effects of a combination of these. Much of these frustrations and dissatisfaction experienced by insomnia patients is caused by the amount of night-to-night variability of the sleep. They go to the bed, they can't get the sleep, and then there a lot of tension comes in. As if that there is a kind of a punishment for them to go to the bedroom. This happens when the insomniac patients. Then psychiatric disorders such as depression, anxiety are also related. Pain is a medical condition. This may be research. Because of pain, person may not get a proper sleep. Sleeping is generate arousal of bedtime. This anxiety about sleep sustains cycle that perpetuates the insomnia. And one of the report what they say is, suppose if you get up at night 2 times, 3 times, then again the cycle proceeds. Because melatonin loves the darkness, the sleeping hormone or sleeping chemical. And naturally there will be some lights. So make the minimum light in the bedroom or even in other rooms as far as possible, so that one can get sleep. So sleep get disturbed if somebody has to go for a toilet 2 times, 3 times. So this may have other relationship. And diabetic patients, they have to go to the toilet for a very number of times. So that is why they will not get sleep. So there will be a depression, there will be a fatigue. All things are interconnected. Insomnia is widespread health complaint and the most common. And insomnia related accidents vary in $1. Everything, the treatment of insomnia, the patient, if person is insomniac, he goes to the office, he will not work, daytime sleeping, all things included in this particular slide. So sleep, approximately 35% of the adult population have insomnia during their course of a year. Up to 7% indicate insomnia is a chronic, severe or both, in contrast to the occasional sleepiness. Right? And this has been given in alternative medicine review, value file number 3. Now, snoring is also a disorder of sleep. The obstructive sleep apnea, there is a two things are different. Sleep apnea is also always a kind of obstruction. But that may be just for 10 seconds. 10 seconds, one breathe stops. And then the snoring comes. The snoring is normally the muscles of the upper part of the throat helps the airway. When you are sleeping, the airway go in that.